My name is Meredith Brooks, and this is my story. I was born in Nashville, Tennessee, in a small town about 15 minutes outside of the city called Hendersonville. I grew up with my mom, dad, and sister up until the age of 8 when we moved to Indianapolis, Indiana for my dad's job. Much of my life was normal until I got to high school. I lived a typical life, attended Catholic school, and played sports. I was a cheerleader all through grade school and middle school, and it was something I carried with me to high school. My freshman year of high school was when just about all aspects of my life changed. I was in a cheerleading accident December 7th of 2012 and fell 10 feet head first. I was very lucky because of the way that I fell, as I could have been paralyzed. However, I ended up with only a concussion that lasted 2 months. What my family and doctors thought, however, was just a concussion turned out to be much worse. Along with typical concussion side effects, my body began to develop other symptoms. They seemed to appear slowly, and then in a matter of months, my body was completely broken down. I went from being normal to passing out, and as it progressed, it got to the point that I was passing out multiple times a day. On a good day, only 5 times, and on a bad day, sometimes 20 times. Then I developed seizures. Unable to figure out what was wrong, I went from doctor to doctor until we had seen just about every specialist in the state of Indiana, and nobody could figure out what was wrong with me. It was one night in the emergency department of Riley, when we were heading home after doctors had once again failed to find anything wrong, that a nurse whispered to my mom that she should look up a disorder called POTS. The nurse said she was certain that's what I had. After lots of research, my mom and I found ourselves at the Cleveland Clinic in the hands of Dr. Moodley, one of the lead pediatric neurologists in autonomic dysfunctions. In a matter of 3 days, Dr. Moodley was able to diagnose me with what a handful of doctors over a 6-month span had failed to do. I had a disorder in the autonomic nervous system of my brain called postural orthostatic tachycardia syndrome, and it was a result of my accident. When I fell, my brain shifted inside of my head as it does when a concussion occurs. However, during the shift, trauma was caused to the autonomic nervous system, leading me to develop POTS. To date, there is no known cure for POTS, and very little research about it exists. There are only a handful of specialists that have enough knowledge about it to diagnose and treat patients. POTS is not a rare disorder and affects 1 in 100 Americans. However, it is rarely diagnosed, leaving some to suffer upwards of 5 years before ever receiving a diagnosis. While 6 months seems long, I am one of the lucky ones. Because my POTS had gone untreated for 6 months, it affected my body very negatively and had started to affect all aspects of it. I could no longer walk on my own for the fear of me falling, passing out, or having a seizure was too big of a risk. I was put on a strict treatment of medications, a combination of over 20 pills a day, in attempts to make up for the part of my brain that was no longer working. I was also to rely on a wheelchair for all of my sophomore year to get around, since my muscles and the rest of my body had become too weak. My senior year of high school, my doctors were finally able to come up with the right combination of medications, and after 2 years of physical therapy, I had seemed to slowly regain back my strength and independence. All of the time I spent in and out of the hospital sparked my own interest in medicine. I had learned so much of what it was like to be a patient and had been surrounded by amazing and at the same time not so amazing doctors that I wanted to make my own impact. Too young to officially do anything in the medical world, I set out on a vicious journey to raise as much money as I could for POTS research. I started 3 nonprofit projects and raised a collective of over $1,500 towards research. I also started a blog to empower and guide others in similar situations that has to date over 12,500 views. I speak all over the state of Indiana at colleges and high schools on behalf of Riley Hospital for Children and work towards helping those that aren't familiar with what it's like to grow up in the medical system better understand, so that together we can work together to better the environment for medically unstable children. This past summer, I obtained my EMT certification in both a nationally and state licensed EMT. I am currently a freshman at IUPUI in the School of Health and Rehab Sciences. While I don't know exactly where I'm going to end up, I know I have a love for emergency medicine and giving back. I believe that we as humans have the capability to impact the rest of someone else's tomorrows, and it's up to us whether it is negative or positive impact. I believe that someone shouldn't be judged by their past or what holds them back, because we all deserve the capability to flourish and accomplish our dreams. I believe that my story is not a sad story, and yours doesn't have to be either.